Imagine waking up and suddenly your eye can't move properly and your eyelid starts to sag. Well, that's what happens in diabetic cranial nerve 3 palsy. So, despite the dramatic eye movement problems, the pupil is actually perfectly fine because diabetic ischemia hits the central fibers of the cranial nerve 3. Those are the ones that control your extraocular muscles and your levator palpebrae. But the parasympathetic fibers that control the pupil are spared because they actually run around the outside of the nerve. And so if the eye is down and out, but the pupil still reacts, then diabetes is the culprit. All right, so in diabetic patients, cranial 3, you really got to watch out for this. You have that down and out gaze and normal pupillary function. Okay, so ptosis, down and out, you're unopposed, cranial nerve 4 and 6, and 3 isn't working. Pupils are normal and long-standing diabetes. Okay, then it's going to make us think of nerve ischemia, and parasympathetic fibers are going to be spared because they're located peripherally. So we have a 65-year-old man with diabetes, sudden onset double vision, right-sided ptosis, impaired adduction, and vertical gaze, but the pupil is reactive. Okay, very important, that part. And so, yeah, this is going to be your ischemic injury. So cranial nerve 3 is organized so that the somatic motors, the eye movement is central, and the parasympathetic are peripheral. In diabetes, central ischemia affects the motors first, and so the pupil peripheral remains spared. Nerve compression, that'll cause the pupillary involvement, so like an aneurysm. Nerve inflammation, it's not typical in diabetes. Brain stroke, that would cause other things like ataxia, hemiparesis. Fatigable ptosis and normal eye position would be your myasthenia gravis. Okay, so diabetic neuropathy is going to involve cranial nerve 3, predominantly the central ischemia, so the somatic nerve fibers, not the peripheral ones. So you get that down and out gaze, but then the normal accommodation reflex. All right, hopefully that was helpful. Like and subscribe if this was. We'll see you in the next video.